Hi, my name is Ivan Lira, and this is my persuasive speech on how healthcare should be universal. The purpose of the speech is to persuade the reader to change their views on our current healthcare access. The three main points are going to be what is universal healthcare, obtaining universal healthcare, and the key facts about universal healthcare. 25% of Americans prefer not to go to the doctor because they do not have the money to get treated. Health insurance costs keep escalating. Many do not even have the resources to pay for their medication. Healthcare is essential to every human being, and a change has to be made. What is universal healthcare? Universal healthcare guarantees equality. Everyone receives the same level of healthcare, and you have the opportunity to get treated whenever needed. You can be treated without worrying about how much it will cost you or how much money you have left over after your doctor's visits for your mortgage, utility bills, or even school. Before we get into more information about universal healthcare, let me make it clear that our country ranks significantly low compared to other countries. We rank low in comparison to our healthcare efficiency, cost, access, quality, and life expectancy. We spend twice as much money as other countries and still have a lower life expectancy than them. Is this what we really want? Lack of healthcare insurance coverage may negatively affect health. Uninsured adults are less likely to receive preventative services such for chronic conditions such as diabetes, cancer, and cardiovascular disease. There are currently three plans that we can establish in order to have universal health care here in the United States. First is going to be single payer system, then social health insurance model, and then national health insurance. The first plan that we can try to implement would be the single payer model. Using this plan, our government would provide free healthcare to everyone, and we would pay our healthcare with the revenue from our income taxes. With this plan, our government would also own every service, and the service providers would be considered government employees. Every citizen would have the same access to care, and no one would be left behind. The second plan would include the implement of the social health insurance model. With this plan, everyone would have to purchase health insurance. The taxes would go into health insurance fund controlled by the government, which would help cover every single person. With this plan, private doctors and hospitals would provide services, but the prices of both providers and health insurance would be controlled by the government as well. The third plan that we could implement would be to establish a national health insurance. With this plan, only one insurance company would exist, which would in fact cause costs to be lower. Even though every citizen will have to pay for the national insurance plan, it will help with the help of the government. The cost would be affordable to everyone. More than half of the people living in this world are not able to afford going to the hospital and check up or take vaccinations to prevent causes. Even if they do, they are in debt with medical bills. The key facts about universal healthcare would be having universal healthcare would reduce the risk of people going into poverty or having financial hardships. Some of us do not go to the doctor to get the treatment we need because we are worried and afraid about the financial hardships. Without universal healthcare, it will have them going through their savings and sometimes their children's savings, which will then hurt their children's future. Universal healthcare will allow everyone to get their basic needs of healthcare, essential quality health services, treatments, rehabilitations, as human rights. One thing we can do is help achieve universal healthcare. To help achieve universal healthcare is to sign some petitions. For example, the National Nurses United.org and thechange.org with all these links below. Your signature to these petitions gets us one step closer to healthcare as a fundamental right for every U.S. citizen. Another thing we can do is contact Congress. We can contact them to see how they feel about the national healthcare system, how the national healthcare system is now, how we can see how they are going to provide change for it if they're thinking about changing the healthcare system. And below, here's the link of how you contact Congress.